Hi dear students, welcome to Pharmacology. In this session, let us learn about the uses of adrenergic drugs. This is one topic which you need to be aware of and very important from the exam point of view. So based on the classification, let us understand the uses of adrenergic drugs. So how do you classify adrenergic drugs? So it can be classified into direct adrenergic agonist, indirect adrenergic agonist, as well as mixed adrenergic agonist, or it is also called as directly acting sympathomimetic agent, indirectly acting sympathomimetic agent, as well as mixed acting sympathomimetic agents. Why they are called adrenergic drugs or adrenergic agonist? They have a effects or a property similar to that of the sympathetic nervous system. Means they're going to produce the action similar to that of the endogenous catecholamine, that is the epinephrine, norepinephrine, etc. So what do you understand by directly acting sympathomimetic agent? So directly acting sympathomimetic agent means these are the drugs which will going to directly bind to the adrenergic receptors. So which are the adrenergic receptors here? This will bind to either alpha receptors or beta receptor to produce the effect. What do you understand by indirectly acting sympathomimetic agent? Indirectly acting sympathomimetic agents are the one which will not going to directly bind to the alpha or beta receptor. Instead of binding to the alpha or beta receptor, they are going to increase the norepinephrine release. So how do they do? By inhibiting the norepinephrine transporter channel, or it will block the norepinephrine transporter. Thereby what will happen is the recycling or the uptake of the norepinephrine from the synaptic cleft into the presynaptic nerve terminal will not take place, or sometimes the drug will going to stimulate the presynaptic vesicles. Thereby, it releases the norepinephrine into the synaptic cleft. Thereby, it can act on the alpha as well as beta receptor. But these drugs will not come directly in contact with the either alpha or beta receptor. But instead of it, they're going to block the transporter channel. Thereby, the norepinephrine will not go back into the presynaptic vesicle storage. Thereby, the concentration of the norepinephrine will be high in the synaptic cleft. So what about the mixedly acting drug? Acting drug means these drugs have got both the properties. So what do you mean by both the properties? So either they can act directly on the alpha as well as beta receptor, or it can block the norepinephrine transporter. Thereby, it can increase the norepinephrine levels. So the reuptake mechanism will be inhibited. So basic thing you should remember is directly acting, they're going to directly bind to the alpha and beta receptor and they're going to act. Whereas indirectly acting agent, they're going to block the reuptake of norepinephrine from the synaptic cleft. Whereas mixed drugs will going to act by either of this mechanism. So again, directly acting sympathomimetic agent can be classified into non-selective and a selective. So what do you mean by non-selective? Directly acting sympathomimetic agent means they can act on both alpha as well as beta receptor, whereas selective means, so there are certain drugs which can act particularly with alpha 1 receptors. They can act on alpha 2 receptors. There are drugs which can act only on beta 1 receptors or beta 2 receptors as well as beta 3 receptors. Moving on to the non-selective directly acting sympathomimetic agent. So we have an endogenous catecholamine. Endogenous catecholamine here you can remember epinephrine, norepinephrine and the dopamine. So epinephrine, norepinephrine and dopamine, they directly act on the receptor to produce their action. So epinephrine can act on all the receptor. It can act on alpha 1 receptor, alpha 2 receptor, beta 1, beta 2 as well as beta 3. So whereas the norepinephrine has got predominant action on the alpha 1 receptor. Apart from that, they can also act on the alpha 2, beta 1, and it has got weak or no beta 2 action. Whereas dopamine has got dose dependent action. Before going to that, let us understand the uses of epinephrine. So they are the drug of choice for the treatment of anaphylaxis or anaphylactic shock, which has to be treated immediately with a quick response so that it will act as a life-saving drug. So why it is useful in anaphylaxis? Because in anaphylaxis, what happens is there is a fall in blood pressure, as well as there will be vasodilation, because of which there will be a hypotension. And also, what happens to the bronchial smooth muscles? In anaphylaxis, there is a inflammatory mediators will be increased. Because of the histamine, it can cause bronchoconstriction. It can cause laryngeal edema. It can cause allergic-like reactions. So to prevent all those things, what you can give is epinephrine, or it is also called as adrenaline, is a drug of choice, which has to be given through intramuscular injection, 0.3 to 0.5 milligram in a dilution of 1:1000 through intramuscular route. So that by acting on alpha 1 receptor, it will going to cause vasoconstriction. It will going to cause vasoconstriction means, what do you want to understand? The blood pressure which was low will come to normal. So it will going to increase the blood pressure. By acting on beta 2 receptor, what will happen? Beta 2 receptor agonist will cause bronchodilation because of the bronchial smooth muscle relaxation, which occurs due to increase in the cyclic AMP levels. So please remember, guys, epinephrine, it's a drug of choice in the treatment of anaphylactic reaction or anaphylactic shock. Second use is they can be used for controlling bleeding. You would have heard the bleeding through the nose. So what do you call a bleeding through the nose? The condition is called as epistaxis. What you're going to do is you will take a gauze piece which will be soaked with the epinephrine, etc. So when you keep that gauze piece, it will going to cause nasal mucosal vasoconstriction, thereby it reduces the bleeding. So epinephrine can also be used with the local anesthetics to prolong the local anesthetic action. So by doing so, the local anesthetic action will remain for a longer duration of time, and also the dose which is required is very, very less. So when you combine epinephrine with a local anesthetic, the dose which is required is very less with respect to local anesthetic, and also it prolongs the duration of action of local anesthetic. As the epinephrine causes vasoconstriction, the local anesthetic will remain at the site of action which is required, and it will not be removed through the systemic circulation because the vessels are narrowed. So next is, it can be used in elevating the blood pressure in case of postural fall in blood pressure. And also epinephrine can be used through intravenous route, or if intravenous route is not acting, you can go for intracardiac injection in case of cardiac arrest patient. So what are all the uses of epinephrine? So first one is it's a drug of choice in anaphylactic shock. Second one is to control the bleeding, epistaxis, along with local anesthetic to prolong the action of local anesthetic. Fourth use is in case of postural fall in blood pressure and postural hypotension, and in case of cardiac arrest. Coming to the uses of norepinephrine. So norepinephrine predominantly acts on the alpha receptor, thereby it can be used for hypotensive shock conditions which are associated with the hypotensive shock. Then it can be used in case of cardiac arrest as well. And coming to the dopamine action, dopamine has got dose dependent action, and based on the dose dependent action, you can remember the indications of dopamine. So at low doses, they activate D1 receptor, which is present in the renal blood vessels, and thereby it causes vasodilation in the renal system. Thereby it increases the renal perfusion, thereby the renal damage can be decreased in case of shocks. So by acting on the beta 1, so To act on beta 1, the dose has to be increased. So low dose, it acts on only the dopamine 1 receptor. At moderate to intermediate dose, it will act on additionally, apart from D1, it also activates beta 1. So as you know that all of you, beta 1 is present in the heart, thereby it increases the contraction, it increases the heart rate. So low to moderate doses of dopamine can be made utilized for the treatment of cardiogenic shock. So what about the alpha 1? So alpha 1 activation will occur at the higher doses, and it is not required for treatment of cardiogenic shock, because already in cardiogenic shock the vessels will be vasoconstricted. So upon that, if you give a higher doses of dopamine, what will be happening? It will going to cause further vasoconstriction, and there will be decrease in the perfusion to the end organs, and it will create a lot of problem. So these are the uses. Coming to the selective directly acting sympathomimetic agents. So let us understand here. Here you can see which is the alpha 1 selective directly acting sympathomimetic agent. We have phenylephrine, oxymetazoline. So phenylephrine and oxymetazoline can be used for nasal decongest as a nasal decongestant. So it will going to cause again the vasoconstriction of the nasal mucosal blood vessel. Thereby it reduces the congestion as well as the inflammatory mediators. In additionally, the phenylephrine can also be used to treat it causes mydriasis. Phenylephrine will cause mydriasis, and there are drugs which can decrease the glaucoma also. There are alpha 1 derivatives. They are epinephrine, brimonidine, etc., which will going to decrease the aqueous humor secretion. Thereby it can be made utilized in the treatment of glaucoma. Then we have a selective alpha 2 agonist, that is clonidine, which is a centrally acting alpha 2 agonist. Alpha 2 is present in the presynaptic junction. By activation of the alpha 2 receptors will cause negative feedback mechanism. That means it will going to inhibit the storage and release of the norepinephrine. So therefore norepinephrine will not going to act, or the levels of norepinephrine will come down. Thereby it can be made utilized in the treatment of the hypertension. Additionally, clonidine are also useful in the treatment of attention deficit hyperactive disorder. Also, they are useful in case of withdrawal from the alcohol as well as to treat the withdrawal symptoms from the opioids. The next we have a selective beta 1 receptor, that is dobutamine, which particularly act on the predominantly on the beta 1 receptor, and they are very useful in case of cardiogenic shock. Next, coming to the selective beta 2 activity. Selective beta 2 agonists can be classified into short acting beta 2 agonist and long acting beta 2 agonist. Under short acting beta 2 agonist, you have got a salbutamol, which is a treatment of choice for acute bronchospasm. But salbutamol cannot be used in case of prophylaxis or chronic asthma, but they are very useful in case of acute bronchospasm. So in case of longer acting beta 2 agonist, we have a longer acting drug, that is salmeterol, formoterol, etc. These are not useful in case of treating acute bronchospasm, but they are helpful in case of prophylaxis, along with the corticosteroids and antimuscarinic agents like ipratropium bromide in the treatment of chronic asthma as well as COPD. Then moving on to the selective beta 3 agonist. As you know that beta 3 is responsible for the lipolytic activity in the adipose tissue. Apart from that, beta 3 is also present in the detrusor smooth muscles of the bladder. So activation of beta 3 receptors will going to cause relaxation of the bladder smooth muscle, thereby it increases the capacity of the bladder. The one such drug which can activate the beta 3 receptor is mirabegron. They are useful in the treatment of overactive bladder. Next, coming to the indirectly acting sympathomimetic agent. As you know that they are going to increase the norepinephrine release by blocking the norepinephrine transporter reuptake mechanism. So the example are amphetamine and cocaine. Cocaine is not used nowadays because of their abuse and addiction potential, and also the risk of toxicity like seizures, etc. And amphetamine will going to act by blocking the reuptake transporter, that is norepinephrine transporter, as well as dopamine reuptake mechanism will be blocked. Thereby it increases the norepinephrine levels as well as dopamine, and they are useful in the treatment of ADHD as well as in the narcolepsy. Next is the mixed symptomatic agent. So here you have example of ephedrine and pseudoephedrine. As you know that ephedrine and pseudoephedrine are known to act predominantly on alpha 1 receptor as well as beta receptors. By acting on alpha 1, it causes vasoconstriction. By acting on beta 2 receptor, it causes the bronchodilation in the bronchial smooth muscles. And pseudoephedrine is particularly act predominantly on the alpha 1 receptor. Thereby the pseudoephedrine can be made utilized in the treatment of nasal congestion. So it can be used as a nasal decongestant. So what are the side effects you can face when you come across the adrenergic agonist? So due to the vasoconstriction, which is mediated by alpha 1 receptor in the blood vessel, it can lead to rise in blood pressure, that is hypertension. So hypertensive patient, the blood pressure rise can happen and it can worsen. So it can increase the heart rate. It should never be given in patients who are having angina, arrhythmia, as well as the myocardial infarction related patients. So because of the vasoconstriction, these drugs can increase the risk of myocardial infarction, arrhythmias, as well as hypertension, etc. By acting on the beta receptors, these drugs will going to cause the hypokalemia as well as tremors and reflex tachycardia. So this was all about the adrenergic drugs and their uses based on their classification, that is directly acting, indirectly acting, and mixed drugs. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, for more updates on pharmacology. Thank you.